Some people see it as a surprising trend. Other people a little concerned, though, about just how safe it may be. Medical correspondent and OBGYN Dr. Jennifer Ashton has a look at what's truly at stake for moms and their families.
Growing up, when I thought about childbirth in the hospital, it always seemed so scary and painful.
When the time came to plan the birth of their third child, Rena and Julian Dotson decided the baby would be born in their home.
I wanted to have my baby at home because I wanted to give my child the best birth experience.
During contractions, she laid face down on the living room couch, her sister and a midwife rubbing her back. Downstairs, the kids watched TV while eagerly awaiting the new arrival.
Hi, baby. Hi, baby. Hi.
When the moment of truth came, Dad helped deliver the baby and then literally jumped for joy.
That's the best thing about having a home birth is you can control the whole environment.
Yeah.
You know?
There's more control. And you know that if something doesn't go as planned, that you have medical professionals there who can help you.
The Dotsons are not alone. The percentage of parents opting to have their babies at home jumped by 20% from 2004 to 2008.
We have a waiting list every single month of people who would really like to give birth with our service.
Alice Bayless is a certified nurse midwife. In addition to Isaiah Dotson, she's delivered 1,500 babies in non-hospital settings. She says one of the main reasons her clients choose home birth is
to avoid unnecessary intervention. It's not that they want to avoid technology altogether, but they want to use technology judiciously.
That includes induction agents, anesthesia, and especially C-sections, which have risen from just 4.5% of all births in 1965 to 34%, about 1 in 3 today.
One of my main concerns is the increased incidence of cesarean sections in this country.
But are home births safe? The American College of Obstetricians and Gynecologists released a statement earlier this year saying, quote, although the absolute risk of planned home births is low, published medical evidence shows it does carry a 2 to 3-fold increase in the risk of newborn death compared with planned hospital births.
In an emergency, seconds can count, and it can take a long time to transfer a patient from a home setting to a hospital. But in a hospital setting, we're able to intervene much more quickly.
But for the Dotsons, the birth of baby Isaiah could hardly have gone more smoothly. No drugs, no surgery, and a happy, healthy baby.
The home birth experience was amazing. It was wonderful.
So prospective parents, are they getting enough information when they're going to make their decision on where to have the baby?
Well, information is so important, whether you're planning a home birth or whether you're planning a birth in a hospital setting. And it's important to remember that there are certain types of emergencies that can and do occur even in low-risk women in which seconds and minutes count. The placenta can detach from the wall of the uterus. There can be a postpartum hemorrhage where the mother loses liters of blood in minutes. The umbilical cord can fall out and compress the oxygen supply to the baby. These kind of things can occur without warning, and then even in a hospital setting, it can be difficult.
Jen, you've delivered over 1,000 babies, some of them not all in hospitals, some of them in birthing centers. Right. What does a family need to consider before they make the decision to have a home birth?
A couple of things, and we need to underscore these are only for low-risk women, but they want to find out, is your provider licensed? Is there an obstetrician available on backup? And how far away are you from the hospital? Because if it's 30 minutes, that is way too long.
All right, seconds count.
Absolutely.
Jen, thanks.
Jen Creation, thank you. Up next, don't let the falling